Hypothermia and hyperthermia. Hyperthermia. Hyperthermia occurs when the body's heat production or exposure to external heat exceeds its ability to dissipate heat, resulting in an abnormally elevated core temperature. Types: heat cramps, painful muscle spasms due to electrolyte loss during heavy sweating. Heat exhaustion, excess sweating with symptoms such as nausea, headache, and dizziness without organ failure. And heat stroke. This is the most severe form, core temperature over 40 degrees Celsius with failure of thermoregulatory mechanisms, confusion or unconsciousness, and potential multi-organ failure. Symptoms: excessive sweating in mild hyperthermia. In heat stroke, sweating may stop. Rapid breathing and tachycardia. Nausea and vomiting. Muscle cramps and weakness. Headache, confusion, dizziness. Loss of consciousness in heat stroke. And red hot dry skin in heat stroke. Signs: heat exhaustion 38 to 40 degrees Celsius. Profuse sweating, pale clammy skin, tachycardia, tachypnea, weakness and fatigue, dizziness or fainting. Heat stroke over 40 degrees Celsius. Hot dry skin, altered mental status, hypotension, evidence of organ dysfunction, and unconsciousness. Causes: environmental heat exposure, prolonged time in high temperatures, particularly hot, humid conditions that reduce sweat evaporation. Strenuous activity in heat, this increases metabolic heat load. Impaired thermoregulation, dehydration, heavy non-breathable clothing, or conditions limiting sweat evaporation. And medications or substances, stimulants, for example cocaine and amphetamines, diuretics, and antipsychotics. Complications: neurological, cerebral edema, seizures, coma. Cardiovascular, arrhythmias, hypotension, and shock. Renal, acute kidney injury from dehydration and rhabdomyolysis. Hepatic, liver failure from heat injury. Metabolic, electrolyte disturbances, for example hyperkalemia and hyponatremia, and rhabdomyolysis. Coagulopathy or DIC, due to endothelial injury and inflammatory activation. And cardiac arrest. Prevention: avoid peak heat hours and seek shade or cool environments. Wear light breathable fabrics. Maintain hydration. And gradual acclimatization to heat. Management: move to a cooler environment. Apply ice packs to the neck, axilla, and groin with cloth barrier, or use cool, damp towels. Oral fluids and electrolytes if conscious. For heat stroke, urgent hospital care and rapid cooling, for example cold water immersion and IV fluids. Hypothermia. Hypothermia occurs when core body temperature falls below 35 degrees Celsius due to excessive heat loss or impaired heat production. Mild, 32 to 35 degrees Celsius, shivering, cold pale skin, and confusion. Moderate, 28 to 32 degrees Celsius, worsening confusion, lethargy, loss of shivering, and reduced coordination. And severe, less than 28 degrees Celsius, unconsciousness, profound bradycardia, and high risk of death. Symptoms: cold, pale, or bluish skin. Shivering, which may stop in moderate to severe cases. Slurred speech. poor coordination and stumbling, confusion, fatigue, drowsiness, and loss of consciousness if severe. Signs: mild 32 to 35 degrees Celsius, shivering, cold pale skin, tachycardia, tachypnea, and peripheral vasoconstriction. Moderate 28 to 32 degrees Celsius, slurred speech and confusion, loss of shivering, and bradycardia, hypotension, and bradypnea. Severe, less than 28 degrees Celsius, unconsciousness or coma, arrhythmias, fixed dilated pupils, pulmonary edema, and cardiac arrest. Causes: prolonged cold exposure without adequate shelter or clothing, wet clothing increasing conductive heat loss, inadequate insulation, medical conditions, for example hypothyroidism and diabetes, and alcohol and certain drugs. These reduce heat production and impair awareness of cold. Complications: cardiac, arrhythmias and cardiac arrest, neurological, confusion and coma, respiratory, depression or failure and aspiration pneumonia, metabolic, lactic acidosis and hypoglycemia, renal, AKI from cold diuresis and reduced renal perfusion, hematological, coagulopathy, and peripheral injury, frostbite. Prevention: wear layered insulated windproof clothing, keep dry and change wet clothes promptly, avoid alcohol in cold conditions, and carry emergency warmth supplies in remote or cold environments. Management: move to a warm, sheltered environment and remove wet clothing. Passive rewarming, blankets and warm clothing. Active external rewarming, warm packs to the chest, neck and groin, and warmed oral fluids if conscious. Active internal rewarming, hospital, warmed IV fluids, heated humidified oxygen, and extracorporeal rewarming in severe cases. That was the full video, and there's hundreds more like it waiting for you at finalmed.co.uk. Get over 9,000 UKMLA exam questions, hundreds of animated videos, and our trusted textbook all in one platform designed to make your revision faster, clearer, and exam focused. Start your free 7-day trial today